So welcome to today's workshop on female hormones. And we'll be looking at a functional medicine approach on how to feel and look your best for longer. Okay, so we will touch upon some of the most common female health conditions today. A lot of you, probably the reason you're joining today is that you're suffering from some of them, or you know some people that do. PMS, very common. Some people that even have PMDD, where they feel really horrible, even suicidal before their period. Many people have painful periods, heavy periods, feel bloated, puffy sometime in their cycle, have cysts, fibroids, maybe even endometriosis. PCOS is a very common concern. I know that some of you today have that. Hormonal acne, having hair growth in the wrong places, having hair growth where it shouldn't be, not enough on the head where it should be, having recurrent thrush and vaginal infections, cellulite, thyroid issues, having issues with body weight and toning up, but also anxieties, mood swings, and perimenopause chaos. So those are some of the common health issues that are related to hormones that a lot of women have, and often they're being shrugged off because it's just so common. So people almost don't do anything about it. And they often have something to do with the cycle. We'll talk about that in more depth in a moment. Oftentimes, when you go to a gynecologist, a GP, they will give you the pill to suppress that cycle that can mess with this, and we'll go into a lot more detail there in a moment. Or they will give you ibuprofen, anti-inflammatories for your period pain, maybe antibiotics if you have recurrent thrush and then it just keeps coming back, antidepressants if you have severe mood swings, or HRT. And all of those can work wonders, but they can also have side effects. So we will be looking a little bit more into the depth of what's actually going on behind what you can do to support these issues, those hormones, so that you might eventually be able to not have to take those pills or less of it. Okay, so what is functional medicine? Let's go back to the other slide. This one's quite overwhelming always. The ones that might not know it, in functional medicine, we always look at the underlying triggers. So rather than saying this is the diagnosis, PMS or endometriosis, we look at what's actually causing it. What are the underlying issues? And that's where this next slide comes in. The end results can be anything like digestive issues, immune system problems, heart attacks, autoimmune disease. But inside, there's all these we have this cogwheel machinery of health inside of us. And if that works well, then everything else falls into a place and we function optimally. We don't have symptoms. And if something in the middle here, blood sugar issues, inflammation, doesn't work well, then it has a knock-on effect on everything else and things just don't work that well anymore. And we will be looking at what are these underlying factors that can cause these hormonal issues for you. Okay, so you might be thinking, I get this question a lot, but isn't everything set in stone? Isn't it genetics anyways? My mom had these issues, now I have these issues, or my sister has these issues. Now there is a component here. There's a big debate in science, and there's a lot of research in the last decade or even longer about nature versus nurture. They are doing a lot of twin studies where they take identical twins with the same DNA, the same genetic material, and they put them into different environments. And then they actually have very different health outcomes later on in life. And that's quite empowering, I find, because that means that even though we might have certain genetic weaknesses towards painful periods or endometriosis, but that doesn't mean necessarily that we have to go down that path. If we can make certain changes that can help with that, there might still be a predisposition. It might be, we might have to work a little harder if there is a genetic component to it, but we can always switch and decide what we do with our life. And that's what we will be talking about today, what you can do. Because our genes, we can't really change. Another part that functional medicine addresses, and I want to briefly touch upon today, is that we don't just want to, let's say, normal medicine often looks at if someone has severe issues, then they will do something about it, which is obviously very life-saving. It's very important. But in functional medicine, we often want to take it that step further of saying, how can we actually make someone optimal? How can we allow that person to have optimal health? So they're a combination of physical well-being, a long life, but also emotional well-being. And that in the middle here is called health span. And that's where you thrive, where you feel good, you look good, you have energy, and you don't have all these niggly issues that are just maybe not a real issue, so they don't need medical help, but they're just degrading your quality of life. So today I'm trying to give you some tricks and tools to support that health span. Okay. And then with functional medicine and the way I practice it, precision health, is that we also then usually add some lab testing to make some more bespoke choices rather than just guessing, saying you need a little bit more greens or a little more sleep. You can take it to the next level, and we'll talk about that in the end, what sort of things are available, so that you can be empowered to become the CEO of your own health. I always like to give people the information so that you can then make educated choices yourself, rather than having all these weird symptoms or someone telling you do this diet or do that and you don't actually understand why. I always try and give people the knowledge and information so that you can then decide, okay, this works for me and this is why this is happening, and you can make those educated choices and become empowered to take charge of your own health journey. Medical disclaimer, briefly, obviously it's important that none of the information given today is instead of going to a doctor. If you have any symptoms, please always go and get it checked out. Don't just try and self-medicate, try these things, go and actually get it checked out and make sure there's nothing serious happening. And then you can try and make those lifestyle changes yourself. Okay. So today I want you to get some knowledge so you can make educated choices yourself. Okay, let's dive in. Obviously, there are lots of different people. I don't know what your backgrounds are. So I saw in the list that I got sent just before, there's different ages. I think there are people from all the way from 20 to mid 50s today. So we have a broad spectrum, I'm assuming, of different hormone issues. So I'll try and touch upon different topics. So our hormones, we have lots of hormones in the body, and they're like messenger chemicals. They get secreted in a gland, and then they go throughout the body and they have an effect on different organs. And we have different hormone glands. The most important ones are those here. So we have in the brain is kind of the master switch. It tells the rest of the body what kind of hormones to make and when to stop making them. So a lot of hormone issues actually go back to our brain, not telling the rest of the body that there's enough of that, or not getting the right signals. Then we obviously have Then there's this is our brain. Then we have the parathyroid gland, the thyroid gland. A lot of people know about the thyroid gland because it regulates metabolism. Then we have our adrenal glands around the kidneys, and they are very important for our stress response. We'll talk about all of that in more detail in a moment. And then we have our ovaries that produce estrogen, progesterone, but also testosterone, those kinds of hormones that are very important for our female characteristics. Now, as you can see here, we have this natural hormone, this natural cycle. This year, a normal menstrual cycle is about 28 days long, and day 0 being the first day of our period. And then we usually go through this fairly steady rhythm. And there's these different hormones that play a very important role. A lot of you might have heard about these things. So first of all, we menstruate, and then we don't menstruate anymore, but we have these hormonal changes. Now, oftentimes when we have hormone-related issues like PMS, painful periods, endometriosis, they are imbalances in this estrogen and progesterone balance. They don't have these nice little peaks as they should be. And then we run into issues, and we'll talk about that a little more. Okay, so I'll touch upon a few of the different most common symptoms and what their underlying triggers are, and then we dive deeper into why these things are happening and what we can do about it. So the first of it is PMS, or the worst case of it, PMDD, where the week before the period, sometimes even 2 weeks before the period, we get mood swings, our breasts get painful, we might feel all moody and anxious, and we might want to eat more than we should be eating, lots of different symptoms. and they can be quite debilitating. And oftentimes it's, so here you can see the second half of the cycle, we should be having a nice peak of progesterone. Progesterone is needed to make us feel calm and balanced. Now, progesterone also helps to stop things grow. Estrogen, on the contrary, sorry, here we are. So we have estrogen here in the first part of the cycle. We need a nice peak here in the just before ovulation that signals the brain to give the right signals back to the ovaries to ovulate. And then it should drop. And then the second part, you can see the yellow part, estrogen should be lower, progesterone should be higher. Now, if there's not enough progesterone in that second part of the cycle for one or another reason, then it can make us give us mood swings, make us moody, because progesterone helps our brain act on something called GABA. GABA helps us be calm, happy, sleep well. So oftentimes you have sleep issues in that second part of the cycle. Other reasons for that can be that we don't have enough proteins and other nutrients. We'll talk about that more later, but protein is very much needed to help produce GABA. It also is needed, especially in that second part of the cycle, to help with our thyroid. And our thyroid is important for that progesterone part. Often people, it's so much data now on social media, people hear about estrogen dominance, not enough progesterone, but there's usually much more to that. It's not just progesterone being low, there are other factors that lead to that. Another underlying reason for PMS or even PMDD can be that there's inflammation. We'll get to the reason for inflammation later. And if there's inflammation for one or another reason, then it actually makes our brain not able to make as much happy chemicals. Serotonin makes us happy and calm. And if our brain is inflamed, then it doesn't make serotonin, it makes something else. And that can contribute to these often debilitating mood swings. Oftentimes I also see that people actually have, when I test them, they have a thyroid autoimmune component. So there's the immune system attacking their thyroid, and they can't actually, the thyroid doesn't do its thing. So it can't help with that progesterone production. It can't help the progesterone send the signals to the brain and keep us calm and happy. Another reason for PMS is often that if there's circadian rhythm disruptions, if we don't have for example, have shift work, or we work really late, we don't have the right rhythm during the day, we have a lot of light exposure at night, then that can also contribute to PMS and PMDD. Another very common problem are painful and heavy periods. They're slightly different, but linked. So oftentimes, and I'm assuming a lot of you probably have Googled things and read up on things at some point or another, very common thing that comes up is called estrogen dominance in relation to painful and heavy periods. Now, estrogen dominance is when in this second part of the cycle, you can see here again, the progesterone is that blue line and the yellow line is estrogen. They should be in a nice balance. Now, if either there's too much estrogen and the normal amount of progesterone, that gives us estrogen dominance, or if there's normal amounts of estrogen and not enough progesterone, that also gives us estrogen dominance. Or worst case, we have not enough progesterone and too much estrogen, then it's obviously even worse. Now, estrogen is a wonderful hormone. It's very important. It helps us. It regulates our mood. It regulates our hunger. It actually helps us be less hungry. It makes us more insulin sensitive, so we can eat more food without it storing fat. It also helps things grow. So it helps our skin, our bones. But if it isn't opposed by progesterone, if there's this dominance, then it can grow too much. So that means that in the second part of the cycle, it might start making this lining in the endometrial lining that will then come out during the period. It makes us grow too much. And then all of a sudden, the periods can become very heavy and painful. Another reason for heavy and painful periods, in particular painful periods, is actually inflammation. Now, what research shows is that if we are inflamed, slightly inflamed, in the second part of the cycle, then our periods become much more painful because there's there's something called prostaglandins that are pain signals, and they will stimulate the brain to give us it makes us cramp down there. Another reason that's often overlooked are actually trigger points. If our muscles in our pelvic floor and core muscles are too tight, we can form trigger points like little adhesions and knots, and they can also contribute to very painful periods. And oftentimes, if people train a lot, if they do a lot of Pilates and core work, which is very important, but if they overtrain that and that gets too tight, that can also contribute to painful periods. Other common symptoms of estrogen dominance are, so it also contributes to that PMS, because PMS has to do with not enough progesterone. It contributes to painful, heavy periods, like I said, but it also contributes to more growth of other things. So, for example, cysts and fibroids in our ovaries, in our uterus, in our breasts, if there's something growing, that often has a component of too much estrogen and not enough progesterone. Endometriosis is also too much growth of that endometrial tissue in the wrong places. And that often has that component of too much estrogen that's not opposed by enough progesterone. When that's happening, if things down there are not really well organized in our lining in the uterus, then it can make it much harder to conceive as well. Progesterone is actually very important for everything down there to make things nice and stable so an egg can implant. It can also give us anxiety, mood swings. I've talked about that before. If there's not enough progesterone helps us make these nice neurotransmitters in the brain that make us calm, make us sleep better. But another part that I see a lot and that people ask me about is histamine intolerance. And histamine is something that we know from allergies when we have an allergic reaction, but it can also, someone's doing something, I don't know. Another thing that happens with histamine is that oftentimes when there's a lot of estrogen, it can actually make our histamine intolerance worse. So often people are very intolerant to certain foods. They react a lot worse to wine or fermented foods. That's often called histamine intolerance, and that can be made worse by estrogen dominance. And then another one, and I've seen that a lot of you are in that kind of age bracket where you may be interested in perimenopause, those years leading up to menopause. And oftentimes, eventually, once we hit menopause and our period stops, our hormones drop. But the years leading up, when there can be a lot of chaos and symptoms, it often has to do with estrogen dominance, because progesterone often starts to drop much quicker and estrogen stays high or goes even higher. And that then all of a sudden gives us really heavy periods, painful periods, makes things grow. So it's very common to all of a sudden in the 40s have cysts and fibroids and have a lot worse cycles. Another, I know that some of you joining today are joining because of this issue, PCOS, which is also very common. And PCOS can be quite debilitating. It can cause long cycles, sometimes even and very often with no ovulation in the middle. So it becomes very difficult to conceive. Often it can have other symptoms like acne, like I said in the beginning, hirsutism, where we have hair growth in unwanted areas like our skin, in our face, but then hair loss in where we shouldn't be losing it. And underlying reasons for that is often in normal medical science as well, is testosterone and androgens are a type of testosterone is a type of androgen. We have a dominance of that, so high testosterone levels, and that's very commonly seen in people that are obese, but also in people that are skinny. And I'll touch upon that later, because a lot has to do actually with blood sugar, inflammation, and stress level. What people usually talk about with PCOS is people that are obese, and obviously then often losing weight can help with that. But there are also quite a lot of people, and it's particularly the people that come and see me, that are skinny, but they still have PCOS. And that's often then due to these other factors, blood sugar issues, inflammation that is coming from somewhere, and we'll discuss where that could be coming from, and stress hormone imbalances. Okay, and then like I said before, once we then get to closer to menopause, often all of our hormones drop. Once we hit menopause, they do drop. There's no way around it. But also sometimes I see that in younger women that are very skinny, overtrain, over exercise, or they're burnt out or have an autoimmunity. So the body is just under so much stress that it starts to drop all hormones. And that can make it very difficult to conceive. It can give us brittle bones, low muscle tone, problems with concentration, mood, hot flashes. They are usually due to low overall hormones. Okay. And then lastly, another common condition is low thyroid. And in the other ones, let me just quickly go back there. So oftentimes when people are estrogen dominant, they have more of a pear shape where they accumulate weight around the hips and around the legs and have more cellulite. Not always, but that's the most common type. Then if someone is more that PCOS type, that insulin resistant type, inflamed type, they have that belly, that apple shape, that belly fat. Even if they're skinny limbs, often that skinny fat type where they don't know what they're doing, but they just have this layer around the belly. It's often got to do with inflammation, insulin, and cortisol. This low overall hormone type, like I said, it's usually it's either past menopause or in people that are very skinny, over exercising, so that kind of shape. And then thyroid often gives this overall junkiness, and that is because our thyroid is our master metabolism hormone. Now, if our thyroid is low, it gets very difficult to lose weight. It's possible, obviously, still, but it can make it much harder. So all of a sudden, people might say, I'm eating the same thing, but all of a sudden I'm putting on weight, or I'm finding it really hard that the same strategies don't work anymore. Also, very commonly, they might lose hair, they feel really sensitive to cold, their cholesterol starts to creep up, their mood goes really low, even depression is often linked to low thyroid levels, and then also can be a missing link to having difficulties conceiving. Often that isn't being looked at. Okay, so now we'll look a little deeper at the actual underlying issues. I've just given an overview of what's often addressed in normal medicine with the pill, with antidepressants. They try and fix these things or put a plaster on them, and they often work well, but they obviously have side effects. So we'll look at what's actually causing it. So where's this estrogen dominance coming from, where we have too much estrogen or not enough progesterone? And there's lots of different factors, but some of the most common ones that research shows is, number one is not a fun one. A lot of people still enjoy a glass of wine here and there, but excess alcohol have been shown to increase estrogen. Now, anything more than 7 units in a week have been shown to increase estrogen, have been shown to increase estrogen-related issues, also contribute to a higher risk of breast cancer, which has to do with estrogen. So if you have an estrogen dominance and you do like your drink, you might want to limit that or reduce it and see how that works. Same for dairy. Dairy is healthy unless you have a dairy intolerance, but excess amounts of dairy in itself has some estrogen in it from the animal. And then it can, if you're eating dairy all day and you have estrogen on lab work, you have too much estrogen, then lowering that might help. Some people eat a ton of dairy, and they don't have estrogen dominance issues. So I always like to test things, but those can be issues in susceptible individuals. Very common one is, and that's become popular over the last, I would say, 5 years, when keto and fasting became very popular. For good reasons, because they have wonderful health benefits, but overdoing keto, and especially all of a sudden eating tons and tons of fat, can actually increase estrogen. We'll talk about fasting and keto a little bit later, how to do it safely. Another reason is PTSD, which is obviously something that is a little harder to deal with, post-traumatic stress disorder. So if there's some traumatic experience in the past, and that can be hard to work with, but therapy, cognitive behavioral therapy or other therapies can help with that, to deal with it so that the body doesn't react to that anymore. A very common one that leads to high estrogen are estrogen mimicking substances, endocrine disruptors. You might have heard of that. Things like plastic. So having your takeaway cup of coffee in the morning, it usually has a little layer of plastic in it so that doesn't seep through. That absorbs into the coffee or into your matcha or whatever you'd like to drink, and then you absorb that. Also, if you have takeaway food that is hot food being put into plastic containers, that will absorb into the food. Plastic bottles, you might be thinking you're doing yourself a favor by hydrating and carrying your plastic bottle around, but that will also absorb in small amounts into the water, into the body. And in some people, that can tip it over the edge and just make it, because it mimics estrogen, so the body doesn't know how to deal with it. Some cosmetics as well, they can mimic estrogens, pollution around us. So try and clean up your lifestyle. Candida is a common one. I see this a lot in my patients. So you might have heard of it or not. It's a fungus that we all have some kind of bacteria and fungus in our gut. They need to be in a nice balance, and they're very important for us. But if there's an overgrowth of the bad type, then it becomes an issue. And oftentimes, if we eat a lot of sugars, or we grew up eating a lot of sugars, even if we don't do it anymore now, or we drink wine, things with yeast in it that can feed that candida, the type of fungus, and that has actually been shown to increase estrogen. Also, histamine, I previously mentioned that high estrogen can make histamine issues worse, but high histamine in itself can actually also increase estrogen. And high histamine often comes from these gut issues. So even if we have something called SIBO, small intestinal bacterial overgrowth, a lot of people have that, where they have digestive issues, IBS, irritable bowel syndrome, where they get bloated all the time. That usually means that there's an imbalance in the gut, in our microbiome, and they can then often produce too much histamine, which can lead to more estrogen. If our liver's overburdened, it can also increase our estrogen. So from alcohol, from toxins, our liver needs to break down estrogen. And if that's overburdened, it can't do its job well. So those are some of the common underlying triggers. Some of the issues for that, so you might remember from before, we have either estrogen can go too high, leading to estrogen dominance, or progesterone can go too low. Now, common reasons for progesterone to not be high enough is actually, I should have had this image here. Let me go back briefly. If you remember this here, so progesterone comes up here in the second part of the cycle, and that only comes up if we had a good strong ovulation, because once you can see here that egg is coming out, and only if this happens does this follicle here turn into something called corpus luteum. You don't have to remember this, but this is what is actually producing progesterone in that second part of the cycle. Now, if we didn't have a good ovulation, then this doesn't really happen, and then the body doesn't produce progesterone. Now, they're usually, so what messes with progesterone isn't just in that second part of the cycle, which is where a lot of people always look at, but it is actually around ovulation already. So if we are being really stressed out around the ovulation time, around the day 14 or the days leading up to it, day 12, 13, it sends signals to our brain that it is not safe to ovulate and make babies. Now, even if you don't want to have children, it's still that's how our system works. And our whole, basically all of these hormones are working around ovulation and the potential of creating a baby. And if our brain thinks that we're too stressed for various reasons to carry a baby, so it's not safe to make a baby in that environment, it will mess with the ovulation, which will then mess with progesterone. That is the most common one. A lot of you might relate to that, where you might have a great cycle and then you have a very stressful period, and all of a sudden your cycle goes all wacky and you get all these terrible symptoms. Also, if our thyroid isn't working well, that can also mess with our progesterone production. Okay, another thing that I just wanted to touch upon is that sometimes estrogen levels can be fine, they can be great, but our body isn't breaking them down well. Now you can see here, estrogen here can be broken down to 3 pathways. And the reason I mention that is for breast cancer risk, but also fibroids and cysts and all these excess growth. Now, if our liver works well and our estrogen breakdown works well, then we break the estrogen down into this protective pathway. And even if estrogen's a little high, it's usually not a big deal. However, if for some reason estrogen is broken down into one of these pathways, in particular this one, this 4-1, then that contributes to all of these estrogen dominant symptoms much more than if it was broken down into this one. So sometimes people have on blood testing, they have normal estrogen levels. This is a urine test. It's testing how the body's breaking things down. And if this is high, then that can cause issues. It can also attach itself to our DNA and cause breakages there, and which causes mutations. And if that happens over a long time and excessively, then that can contribute to things like cancers. Okay, sorry, one step back. Reasons this can be, the estrogen pathway can be put towards the toxic ones are these chemicals, pollutants, estrogen mimicking substances, plastics. They can often tip us towards this pathway. Alcohol as well, gut infections, candida, they all make us more prone towards that pathway. Where if we support our liver, then this pathway gets favored. Things like cruciferous vegetables, broccoli, cauliflower, cabbage, kale, they all help the body break it down into the more protective pathway. Okay, so I talked about insulin resistance mostly in regards to PCOS before. And oftentimes, like I said before as well, is that apple shape is where either people are overall heavy or they are actually skinny but have this low layer of belly fat, and then all of a sudden they have these cysts around their ovaries. And insulin resistance is a common cause. So insulin resistance is when our cells stop responding. And say we eat something with sugars in it, any carbs as well, healthy sugars. The body usually then produces insulin to help that sugar and these carbs that break down into sugar to get into our cell, and we use it as energy and do its thing. If our body has too much of that all the time, eventually, so if we overeat all the time, we overeat carbs, we're constantly snacking, eventually the cells might stop to respond to the signal of insulin, and then we're insulin resistant. And that's a very common cause for PCOS. And that then spikes the testosterone, the androgens, and that can contribute to things like unwanted hair growth, acne, these cysts, having issues with fertility. Now, this is often the case when there's people are overweight. However, in skinny ones, it can be that they constantly snack, or they're only living off, even though they're skinny, they're constantly just eating sugary, carby things. It's very common as well. Or there can be other reasons that can lead to insulin resistance. And that can be things like lack of sleep, chronic lack of sleep. Even just one night of lack of sleep, or good quality one, makes the body more insulin resistant the next day. So if we have one night bad sleep, the next day, the cells don't respond so well to insulin. One night, obviously not a big deal, but if that keeps happening, that can contribute to our cells not responding and then contributing to that PCOS type issue. If we're stressed, our brain sends signals to our cells to stop responding to that insulin signal. And then we also become more insulin resistant. And a lot of people are chronically stressed. And then we all of a sudden start to store fat around the waistline, even if we're potentially skinny. And then all of a sudden our cycle goes all wacky. Having low zinc levels can also contribute, and inflammation. That's one of the biggest ones I see actually in my patients, in my PCOS patients, is inflammation. And where is this coming from? Okay, so I mentioned before this gut microbiome, these bacteria and some fungus in our gut. They're very important. They help our body make nutrients. They help break down foods. They assimilate certain nutrients. They help produce neurotransmitters like serotonin, helping us be calm and happy. But if that balance is not right, it can have a whole range of effects in the whole body. It can make us inflamed, because then the body all of a sudden thinks there's something attacking us, and inflammation is a natural response to an invader. Also, it can be chronic infections. So sometimes people have chronic viral infections, for example, long COVID, but also before, after glandular fever, or they're not even sure, chronic herpes virus, HPV. They can constantly be triggering a mini inflammation, even if those infections aren't acute and active and we're not even aware of them, or we have the wrong kind of bacteria in the gut, or that candida that I mentioned. And that can constantly irritate our immune system, and that can make us then insulin resistant and increase the testosterone and androgens. And that, like I said before, I see this inflammation most often in my patients that come in with any kind of PCOS, acne, hair growth issues. Another reason for inflammation, again, similar to insulin resistance, is chronic stress. When we're acutely stressed, just for a day, we have a deadline, then we actually lower inflammation. Our body then gets rid of that so we can deal with that acute stress. We need to run away from the tiger. But if we're chronically stressed, like a lot of people are, they're constantly in fight or flight mode, on the go, then our receptors don't respond that much anymore. And then all of a sudden, it increases our inflammation. And another thing that I see often, that's luckily something that is easily dealt with, is too little omega-3. Omega-3 is mostly found in fish. We need to eat tons of fish to be able to get enough omega-3. Most people don't have enough of that. And that omega-3 is actually needed to get rid of that inflammation. And if we don't have enough, it's really hard to get rid of the inflammation. Okay. And so we talked about the thyroid and how the thyroid is important in that second part of the cycle to help our progesterone, to help our mood, to help our metabolism. And oftentimes people they might not have too low thyroid hormones. So if you go to a doctor and you get your thyroid levels done in blood, they might be okay. But if you have the blood range, they might be just on the bottom of the range, called subclinical hypothyroidism. So it's not an issue, you don't have a thyroid disease, but it's already being sluggish. And then all of these issues with progesterone, with our mood, with our metabolism already start to the whole cogwheel machinery is not working that well anymore. Now, oftentimes that lower than optimal thyroid level can be due to not having enough precursors. Thyroid hormones are made out of protein and iodine. Most people don't eat enough protein, and I know it's in the media a lot nowadays. But I still, when I get my patients to actually calculate their protein intake, they're surprised how little they have and how much they should be having. Another thing that most people that I see and even test for it are low in iodine. Now, iodine is mostly found in seaweed and a little bit in seafood as well. And most people just don't eat enough of that. So we're really low in iodine. And those are the precursors to thyroid hormones. And then once we have the thyroid hormone, we then need to turn it into the active version. And we need a lot of vitamins and minerals to do that. Now, a lot of people are depleted in iron, in other minerals, and they can't make that conversion. So all of a sudden, they're not too low in thyroid, but they're on that low end. Also, having too much sugar and carbohydrates, or constantly being in keto and fasting, both of that can actually mess with our thyroid hormones. And again, stress keeps coming back, messes with our thyroid hormones. And then one that, from a functional medicine perspective, I always like to dig a little deeper. Once the obvious reasons are looked at, what I often find is that people actually have, or quite commonly have, an autoimmune component. So if we were to test autoimmune markers against the thyroid, they're often, in people that have issues there, they're often slightly elevated. They might not be really high yet, so they're not in the range where the doctor would say you have Hashimoto's, but they're already slightly irritating your immune system and not making your thyroid do its thing. And oftentimes that can be triggered by things like, or contributing triggers can be heavy metals like mercury, lead, but also food intolerances. So if your body eats something that for some reason it's chosen to not like, it actually creates the same immune response as if you were being attacked by a virus or bacteria, and then it causes an inflammation. And if that keeps happening, eventually our immune system starts to overreact and doesn't know what to do anymore. If, let's say, you're eating something every day, almonds, something healthy, but your body doesn't actually like it, it can be that then eventually the immune system says, I'm done with this, I don't know what to do anymore, I'm going to start to attack whatever my genetic weak link is, say thyroid. Okay. And this is, I've touched upon cortisol and stress quite a bit already, but I just want to get back to that a little more. So research shows that even if we did everything else well, we're eating well, we're sleeping, we're supplementing, but if we're constantly stressed, that in itself can mess with our hormones. And as I talked about before, if we're really stressed just before ovulation, our brain basically just doesn't think it's safe to make a baby, so it doesn't send the right signals to ovulate, and then we have issues in that second part of the cycle. And that is all the way up to menopause, right? So even all the way up to menopause, we want an ovulation and a nice progesterone estrogen balance here, even if we don't actually want babies anymore potentially, or never wanted them. And if we're stressed, it messes with this part. It has been shown to lower progesterone. And if we're constantly stressed to the point where we're almost burning out, it can just lead to really low hormones all the time, like I spoke about before. It's also really important that we notice that we have a nice daily curve, circadian rhythm. Here you can see this blue curve is our cortisol. This is 6 a.m. and this is 6 p.m. We want cortisol to come up in the morning, have a nice spike. So we're motivated, we have energy to start the day, but then we want it to slowly taper off so that we can then have a nice sleep, and so that melatonin can come up. Now, if we're constantly stressed and running away from a perceived tiger, then cortisol stays too high. And then all of a sudden, this nice spike in the morning that is good for us becomes a problem. We start to become inflamed, and it messes with all of these hormones. It messes with our hunger signals, and all of a sudden we become hungry all the time. And it also messes with melatonin production. So then we can't sleep well. And if you remember from before, I said that with PMS, there's a big component with melatonin and circadian rhythm disruptions. So what research showed is that when people have PMS, they're more likely to have not enough melatonin, too much cortisol. So we want to work on our stress. Now, the problem with stress is that the body can't quite distinguish between real and perceived stress. For us, it's all like a tiger that is chasing us. It can be emotional. That is the one that we usually think about. It can be things like stressors earlier in life, PTSD, traumas, or a work deadline, or a difficult relationship, those kinds of things. But it can actually also be physical. And we often don't think about that. I often have patients that say, I'm not really stressed. But when I test their stress hormone levels, their body is stressed out, and that can be from physical stresses like infections. The body thinks it's being attacked. Food intolerances, again, body thinks it's being attacked. Heavy metals, constantly running off caffeine, too much sugar, they all stress the body out. Overtraining, but also undertraining, both of them signal stress to the body. And then, like I mentioned before, excessive amounts of fasting and keto also make the body think it's starving and it's not getting food, and that makes us run away from that tiger. It's in starvation mode, and then that can mess with our cycle. Okay, and this topic, again, might be one that is very interesting for some of you. I know we're kind of running out of time, so I hope you guys have time later. If you don't have time and you have to jump off, then you'll get the recording and you can watch the rest. Sorry, it's just so many different parts to this hormone puzzle that I wanted to touch up on, most of them. So perimenopause, oftentimes women dread that time because it can be a difficult time, with hot flashes, with brain fog, with mood swings. Period starts to become erratic. Now, and it's talked about a lot nowadays in the media as well, which is a good thing. So people become more aware of it. But what research shows is that obviously all women eventually go through menopause. and the period stops, and also all over the world. Now, there are certain countries where women don't really experience perimenopausal symptoms. They don't have hot flashes, they don't have these issues. And also in our Western world, some women don't get them, where for all of us, hormones will eventually drop. Now, what research shows, if you dig a little deeper, is that when we get towards menopause, our hormones start to decline. Progesterone, like I spoke about before initially, but then also eventually estrogen and testosterone. Now, when estrogen starts to decline, it actually makes our body a little bit more susceptible to temperature swings and stressors. So even though, let's say we have our temperature range in the brain before we have a hot flash is before, when estrogen is nice and high, it's a certain range. But if our estrogen starts to drop, which it will for all women, it will narrow that temperature range, which isn't a problem in itself. It is only a problem if we then have a stressor like adrenaline and cortisol being pumped that then gives us a hot flash, because all of a sudden the body can't deal with it anymore. Or if we have blood sugar swings, that all of a sudden gives us hot flashes because the temperature range has been narrowed. Now, the solution for that is obviously we can't change the fact that estrogen has lowered other than taking HRT, which is an option. But even that won't fix all of it. We can obviously work on our stress levels and our blood sugar levels.